Hello people, in this video we want to look at ranula. Basically in tumors of oral cavity, in the benign lesions, you get this ranula. You can see here below the floor of the mouth, right? You have this mass on one side and it is pushing the tongue up, right? So this is a translucent swelling. It's a cystic swelling, translucent swelling under the tongue in the floor of the mouth. Right, so that is ranula. When this goes deep, it becomes a plunging ranula, and that will become a neck mass. Okay, so in tumors of oral cavity, you have benign tumors. In benign tumors and cystic, here you have the ranula. Cystic means, what is cystic? A fluid-filled one. So here you have your ranula. So in tumors of oral cavity, you can have benign and malignant, and you can have pre-malignant. So benign one, you have the solid and cystic. In the cystic one, you have the ranula. So what is ranula? It is a cystic translucent lesion seen in the floor of the mouth on one side of the frenulum, and it is pushing the tongue up. Okay, so it is on one side, remember, one side of the frenulum, and it is pushing the tongue up. From where is it coming? It is coming from the sublingual salivary gland. This is very important. From where is it coming? It is coming from the salivary gland. Which gland? Sublingual salivary gland. Because of obstruction of its ducts. So the sublingual salivary gland's duct is obstructed and this ranula has formed, which is a translucent cystic lesion. I'm thinking, what will it have then? It will have some saliva only, right? Some ranulae extend into the neck. When they extend into the neck, then it is plunging type. So it will become a neck mass. You will study in neck mass chapter also, you will study this. Right, in neck mass, here you can see in the lateral neck masses in the anterior triangle, they are talking about the plunging ranula. Can you see it? So when this ranula, which is the tongue is here and below the tongue from the sublingual gland, this cystic mass transparent, translucent, right, has come. Now when it is going down, it will cause this lateral neck mass in the anterior triangle. Okay. So where were we? We are looking at this when the ranula extend into the neck, plunging type. Okay. So from where is this ranula coming, guys? It's coming from the sublingual salivary gland. What is frenulum? Do you know? Frenulum. Here you can see this is the frenulum behind your tongue, right? If you lift your tongue and see, you can see the frenulum. Inferior labial frenulum. All these are frenulums. Okay, this is also a frenulum. This is a frenulum. This is the frenulum linguae. Okay, so basically we are concerned with that one. And on one side of it, you will see this translucent cystic lesion. And from where is it coming? It is coming from sublingual gland, sublingual salivary gland when there is obstruction of its duct. How will you treat this, guys? You will excise it if it is small. So if it is small, you can excise it. Then what do you do if it is large? Marsupialization if large. Marsupialization means what? Some pouch kind of thing, right? Like a kangaroo, marsupial. This is what you get when you say marsupialization. You're kind of creating a pouch or something. It is not possible to excise the ranula completely because of its thin wall or ramifications in previous tissue planes. So it is not possible to excise ranula completely. So this is a problem with this ranula. You cannot always excise it completely. So what other things they are telling? They are talking about marsupialization, etc. What is a dermoid? Dermoid is a different thing, okay. It will be white mass, but this whatever you have seen now, that ranula is a translucent one. So it's just a differential. So if you see here, cystic, you have mucocele, ranula and dermoid. Ranula is translucent, dermoid will be white mass, they are saying. Okay, that's it. White mass. Fine, where are we? Here. Now let us see plunging ranula. So basically plunging ranula, what did we see? The same ranula, when it extends down into the neck, it will be called as a plunging ranula. It is a pseudocyst caused by extravasation of mucus from obstructed sublingual salivary gland. Same thing, sublingual salivary gland is obstructed. It presents as an isolated swelling in the submandibular area. So it will be an isolated swelling. So this is in the neck. Remember, in the neck, in the submandibular area, you will have an isolated swelling, lateral, one side only it will be. And it is transilluminant because it's a cyst, right? So it will be transilluminant. Sometimes this plunging ranula coexists with a ranula with the floor on the mouth. That kind of makes sense, right? The same thing on the floor of mouth is plunging or something, or there's yet another one. Treatment is total excision along with removal of sublingual salivary gland. They're talking about removing the salivary gland itself now as a treatment. Wow. Because they cannot excise this ranula completely. Something like that they said, right? What do they mean by the plunging ranula coexists with the ranula? Okay, in the floor of the mouth. This is transilluminant. Okay. So when you examine floor of mouth, guys, you should look for the swelling, ranula, sublingual dermoid, etc. Ludwig's angina, all these will become differentials, right? Ludwig angina also is sublingual space only. So it will be very similar, I think. See, this Ludwig's angina also was is what? Infection of the submandibular space, which is nothing but a sublingual space plus the submaxillary and submental space. So Ludwig angina you have already studied anyways. So plunging ranula, etc. All these will be differentials. Okay. So when you examine floor of mouth, you should check for all this. What and all will you check for? As a swelling, you will check for ranula, dermoid, calculi of the submandibular duct, tumors, Ludwig's angina, all these you can check for. Okay. So what is this? It is a lateral. It can become a plunging ranula as a lateral swelling of the neck in the anterior triangle. So that's all, guys. In this video, we looked at ranula. Ranula is a benign tumor of the oral cavity. It's a cystic benign tumor of the oral cavity. Basically, it is a cystic translucent lesion seen on one side of the frenulum when you push the tongue up. So you will see it on one side of the frenulum. It's a cystic translucent lesion. It arises from where? From the sublingual salivary gland. When the duct is obstructed, then it will develop a ranula. When it goes into the neck, it will become a plunging ranula, which will become a lateral neck mass in the anterior triangle. So treatment is complete surgical excision if it is small, but if it is big, then they'll just do marsupialization. That is the kind of a pouch kind of a thing. It is not possible to excise the ranula completely. Sometimes they're talking about removing sublingual salivary gland itself. Okay. Then dermoid, etc. are going to be its differential. This one is translucent. Remember, dermoid will be white mass. Plunging ranula, we told you when it goes into the neck, right? So this plunging ranula will be a pseudocyst caused by extravasation of mucus from the obstructed salivary gland, that is the sublingual salivary gland. This will be transilluminant. And in this case, they're telling removal of sublingual salivary gland, they're saying. So when you examine floor of mouth, what and all will you check for? You can check as swellings, you can check for ranula, dermoid, calculi, tumors, and Ludwig's angina also can be a differential. So you have looked at the lateral neck masses in the anterior triangle. Here you have the plunging ranula mentioned, right? So it can become a neck mass. What else? This is Ludwig's angina, again of the sublingual space and submandibular, submaxillary, submental space. So one of the differential will be this also. So did you get ranula, guys? Okay, bye-bye.